Hello and welcome to the summer edition of the Director's Cut. I'm Candace Fabi, CEO and Medical Center Director of the VA St. Louis Healthcare System. Here in St. Louis, we provide exceptional healthcare services, but we can't do it without our small army of dedicated VA St. Louis staff. Today, you will get an exclusive behind the scenes look at life at VA St. Louis and how we operate. First, you'll hear from our plastic surgery department and how we transform lives, followed by our Jerry Fit program. You'll hear how veterans over the age of 65 learn preventative maintenance, wellness activities, weight loss activities, and so much more. And then, last but not least, you'll hear from our dental services. Not only are they cleaning teeth, keeping mouths healthy and safe, but they ensure that veterans are ready for care that they may need in the future. See you on the other side.
I'm Dr. Michael Bernstein. I'm the Chief of Plastic Surgery here in the St. Louis VA system. We offer essentially the full spectrum of reconstructive and plastic surgery at the VA. The plastic surgery team here is very well rounded. We offer almost all aspects of plastic surgery, which is a little bit unusual in the VA system. Part of that is because we're the regional hub, but also there's a strong interest here in providing that full spectrum of care. In addition, we are the regional spinal cord center, and so we do the largest volume of complex wound care for spinal cord injury patients in the region.
We treat patients with a lot of problems with the hands and upper extremity, including numbness in the hands or weakness in the hands from nerve compression. I see a lot of patients with wrist and hand arthritis, which is really common in our veteran population. And then we even treat patients who've had weight loss after either surgical procedures or medical procedures to help with weight loss, and we help remove some of the extra skin. One of the things that I really like about being at the VA and being a plastic surgeon is that we collaborate with a lot of other specialties. And so a lot of our patients with skin cancer might come to us from the dermatologist. We see patients from the general surgery and bariatric surgery clinics after patients have lost a lot of weight. We see patients from surgical oncology who have breast cancer reconstruction needs or other needs for breast extra tissue removal. And then my practice, particularly in hand and nerve surgery, overlaps with patients who have spinal cord injury or who have other problems in the hand, including things like heart disease, which actually has some connection to problems with the nerves.
You really don't hear about veterans getting plastic surgery. And if you do, it's more for like combat war veterans that, need reconstruction in some way. Not so much, I guess, breast reconstruction or implants. I'm in remission now, so they knew what they were doing and the cancer's all gone. So I trust them implicitly.
GeroFit is different from traditional exercise or physical therapy programs at the VA because, with regards to traditional exercise, we enroll veterans who are 65 years and older, and we do follow all of the evidence base for exercise guidelines for older adults. And so that includes all aspects of fitness, including the aerobic, flexibility, strength, as well as balance training. So we do specifically work on balance. As far as difference from traditional physical therapy is GeroFit is a wellness and prevention program. It is not rehabilitation. So ideally we are allowing veterans to continue to have their wellness and their strength so that they're not requiring any rehabilitation or any institutionalization. Veterans are also allowed to participate in GeroFit for their lifetime as long as they're meeting the eligibility criteria. And we do allow spouses or caregivers to participate as long as they have also gotten medical clearance from their personal doctor.
So when we're dealing with our older population, it is difficult for them to navigate the technology, the internet. And so, however, we find that the veteran may have a spouse that is a little bit more tech savvy, or children, grandchildren, that is able to help them. We have set separate times aside to do a trial run to help the veteran navigate through the technology in hopes of them being able to participate in the class.
We provide full scope comprehensive dental care for eligible veterans. For those who are not eligible, we provide limited scope services that include relief of pain, treatment of infection, and to prepare them for important medical procedures that they're undergoing.
Oh, we see a wide variety of patients. We see some that are very conscientious about their cleanings, and we see some that are very involved, that they have more complicated cases. So we see all types of veterans, patients here at the VA.
Coming to dental is very important to my health. Proper dental hygiene is important to my cardiac health. I do have cardiac conditions, and it's imperative that I stay on top of my dental hygiene.
We actually have an array of procedures, starting from maintenance, which is our cleaning and regular radiographs. And then for dental work needed, such as fillings, crowns, bridges, dentures, partials. We're looking into developing our implant program right now, so we can place implants here at the VA and not just restore them. The biggest two ways for them to qualify are through either 100% service connection or being unemployable. So that gives them comprehensive dental care. There are some other ways, depending on the percentage of limited motion of the jaw. And then there's temporary care, which relates more if they need a clearance for something like a bisphosphonate medication or cardiac clearance. Then they're eligible for care that helps them get cleared for that particular surgery.
I really hope you enjoyed today's Director's Cut. Be on the lookout for future episodes. Our goal here is to connect you with the VA's wonderful mission. And please remember to be the change you want to see. Take care.